Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pancreatic pseudocyst. A pancreatic pseudocyst is a fluid-filled sac that forms as a result of pancreatitis, that is, inflammation of the pancreas, or it may be result of abdominal trauma, maybe the road traffic accident due to violence. Pseudocysts are usually solitary and may be situated within the pancreas or more commonly in the lesser omental sac or in the retroperitoneum between the stomach and transverse colon or between stomach and liver. So it is usually solitary but may not be solitary. We may have multiple pseudocysts. They can even be subdiaphragmatic. They may present just under the diaphragm. Pseudocysts are lined by fibrous tissue and granulation tissue and range in size from 2 centimeter to 30 centimeter in diameter. Unlike true cysts, pseudocysts lack an epithelial lining as because the cyst sac has no epithelial lining, it is called pseudocyst or false cyst because of lack of epithelial lining. They primarily consist of pancreatic enzyme, blood, and necrotic tissue. So this is a pancreatic cyst. Here is a pancreatic cyst, and it is not lined by epithelial cell. Here another image. If you go to that, here this is not epithelial, this is fibrous tissue, fibroblast, fibrocyte, and also granulation cell here. This is the cystic area, and this image has been taken from Cotton Robbins and Cotton's pathologic basis of disease. Okay, so this is the cyst area. This is the outside, is not lined by epithelium but by fibrous tissue and granulation tissue. Okay, lined by fibrin and granulation tissue. Causes of pancreatic pseudocyst. Why people develop pancreatic pseudocyst? Most important cause is acute or chronic pancreatitis. Trauma, blunt or penetrating trauma to the abdomen can lead to pancreatic damage, resulting in pseudocyst formation. Alcohol use. Alcohol is toxic to the pancreatic substance. So in chronic alcoholism, there is chance of more pancreatitis that may lead to pancreatic pseudocyst. Gallstone can also trigger pancreatitis, particularly if the gallstone is obstructing the common bile duct or the hepatopancreatic ampulla. Then there will be pancreatitis and subsequently pseudocyst formation. Complications of pseudocyst infection. Infected pseudocyst can turn into pancreatic abscesses, requiring urgent treatment. Rupture. A ruptured pseudocyst can lead to internal bleeding or infection, which is a medical emergency. Hemorrhage. Bleeding into the pseudocyst can occur, which may require interventional action. Okay, it may require intervention. Obstruction. Large pseudocyst can compress nearby structure of the stomach bile ducts, or intestine. I'm going to diagnose pancreatic pseudocyst. Diagnosis is typically made through imaging techniques such as CT scan, computerized axial tomography scan. If you have CT image, we can easily find out the pancreatic pseudocyst. Useful, most common imaging test used to visualize the pseudocyst: ultrasound, useful for detecting fluid collection in the abdomen. MRI provide detailed image of soft tissue, which can help in evaluating the structure of pseudocyst. Endoscopic ultrasound, sometimes used to assess the cyst more closely or guiding drainage of the pseudocyst. So it has some therapeutic purpose also. The endoscopic ultrasound treatment is also possible for the guided drainage. We can use the endoscopic ultrasonography. So this is a CT scan here, CT image. So here is the pancreatic pseudocyst, not lined by epithelium, but by fibrin and the granulation tissue. Okay, here that. And it contains pancreatic juice, necrose pancreatic substance may contain the fluid here. It contains fluid here, as it is a cyst. It is a pseudocyst, not lined by epithelium. It contains necrotic pancreatic tissue, maybe some blood here. And this is the CT scan. This is the pancreas. Okay. Here is the pancreatic head, body, tail goes on that side. Okay. This is the right liver, ribs. These are ribs. Right lobe of the liver. And this is the right kidney, left kidney, and this is the lumbar one vertebra. Okay, now go to the treatment of pancreatic pseudocyst. If it is small, asymptomatic, is just need monitoring, irregular imaging. Okay, no symptom, it may not be treated, just observation and regular imaging and monitoring is the management. Drainage, endoscopic drainage, a minimally invasive procedure where a tube is placed through the stomach or small intestine to drain the cyst. Percutaneous drainage involves using a needle to drain the cyst through the skin. Surgical drainage, sometimes necessary, the cyst is large, complicated, or fails to resolve with other methods. Surgical removal may be considered in complications. Prognosis. With appropriate management, the prognosis of pancreatic cirrhosis is usually good. However, complication can lead to severe outcome if not properly treated. Regular follow-up and addressing the underlying causes of pancreatitis are essential to prevent recurrence.